Welcome everybody. Thank you for joining us remotely from WA and from New South Wales. I'm going to be talking about a sort of a high-level summary of findings from the Perth Gay Community Periodic Survey and our most recent round, which was conducted towards the end of last year, which I think for some of us feels like a very long time ago now. Let me just see if I can get this to go down. There we go. So just for those of you who are not aware of the periodic survey, these are repeated cross-sectional community-based surveys of gay and bisexual men. They're designed to inform the HIV and sexual health responses in the various states and territories. In Perth, we've conducted a survey in partnership with the Department of Health, with WAC, the WA AIDS Council, and other interested parties like Curtin University. There are a few people online from there. Every 2 years since 1998, so it's quite a long-standing survey that's been used to guide HIV and sexual health-related programs for gay and bisexual men and to work out what's going on for quite a long time. So one of its advantages is that we now have quite long-term trend data we can look back on and to see what's happening in the more recent period. In the most recent round, recruitment was led by our colleagues at WAC, at the AIDS Council. And a key feature of this type of recruitment is we do community-based recruitment at gay venues and events during a gay or LGBT festival period when there are a lot of people available to recruit. So we did our most recent recruitment during Perth Pride. And this is increasingly supplemented by online recruitment, where we do most advertising through Facebook across the state, across WA, and we've been doing that now for 4 years. And we run that advertising from CSRH. Key feature of the survey is it's a partnership between the researchers at the centre where I work, the Centre for Social Research and Health, the Kirby Institute, also based at UNSW, the AIDS Council, as I mentioned, Curtin University, and the Health Department. And we plan the surveys together, and people have input at various stages into the research design. Now I realised a drawback to my two-screen setup where I can't see the bottom of my slides now because my laptop is in the way. But anyway, there we go. I've also included a link. I've shared the slides here in the chat, but when we also share the streaming, you'll be able to see this link. We publish all the results of the surveys each round on the CSRH website in reports. And there's an image there on the right-hand side of the most recent report, which is available on our website, which has, for people who like data on particular indicators, it's got lots of tables for lots of the main indicators in the questionnaire. And the questionnaire has probably got about 60 or 70 questions in it. We don't put absolutely everything in the report, but it's got quite a lot of stuff in there. So just to remind ourselves, the most recent round we had over 750 participants, gay and bisexual men. Most of the recruitment was from venues and events, but over 40% was online in this most recent round. And I should acknowledge that the proportion recruited online has gone up in the last few years. So that has changed the sample profile a bit. Most of the participants are gay, 1 in 10 identifies as bisexual, most are Australian born. The vast majority of the sample, perhaps reflecting the venue recruitment in particular, is from the Greater Perth area. Quite a high level of university education and full-time employment, and a fairly stable but small Indigenous group of participants in the survey. Okay, so I wanted to start, I'm going to show you a series of indicators from the survey data. When some of you will have seen me present on the surveys before, in the last couple of years we've discussed the introduction of new prevention methods for gay and bisexual men in Perth and across the country, in WA and across the country. And in the last few years we've been talking about what might happen when pre-exposure prophylaxis, so that's sort of regularly taking antiretroviral drugs to prevent HIV infection, what the introduction of that would do. And we've seen some quite dramatic changes across the country. And what this is showing you is some quite dramatic changes in the Perth survey as well, which I think we were expecting to see, but you can evaluate yourself whether they're as dramatic as you expected them to be. So at the top of this graph, we've got awareness of two different strategies. PrEP, which I've just mentioned, which is the preventative taking antiretrovirals prophylactically, and you can see that awareness was among a minority of men a few years ago, and it's now nearly everybody in the survey says they've heard of PrEP. And in blue is an older strategy, PEP. This is post-exposure prophylaxis, and that's taking an emergency course of antiretrovirals after a suspected exposure to HIV. And what we used to say is it was really frustrating that this was available through the public system, through doctors, but particularly hospitals and sexual health clinics. And we could never get a majority of men, they didn't know that PEP existed. And I know some of Lisa's former colleagues, have tried really, really hard to increase PEP awareness in WA among gay and bisexual men. But what you've seen here is that as we've explained to people what PrEP is, they've actually now picked up what PEP is as well. So some of them still don't quite know what it is, but we now have a majority of men saying they know about both strategies. So those are the lines at the top. Lower down, we've got the proportions of non-positive men in the sample who say they've used either strategy, and you can see very few report recent PEP use. That's fairly standard around the country, but there's been a dramatic increase in PrEP use in the last few years, with now a quarter of negative and untested men saying that they're using PrEP at the time, or have recently used PrEP at the time of the survey. As I mentioned, if you don't understand what I'm saying, type a message, or there's not that many of us, maybe unmute and just pipe up and I'll try and answer your question as we go. Okay, so I haven't done too many of, I think this is the only one I've done. We do have the capacity to compare certain indicators across states. That can be a bit competitive at times, so I try and restrict myself to that. This is just showing you all the surveys that were conducted interstate last year and looking at that level of PrEP use. So you can see Perth on the right-hand side with the 25% PrEP use. Perth was the last survey, I think, to be done last year, or Perth and Canberra were done at a similar time. And what's slightly intriguing to me here is that, so the Sydney, actually Melbourne is the first survey in the year, but you can see Sydney and Melbourne are roughly similar level, 30%, 31% use. Queensland, which is done in the middle of the year, it's increased slightly to 33%. Canberra, 36%. That's quite a small, so smaller survey than Perth, and then Perth at 25%. And I don't think any of us quite know why PrEP use isn't perhaps a little bit higher in Perth. Maybe it is now. Who knows? But yeah, it's interesting. It's gone up quite a lot and quite rapidly, but perhaps not. It hasn't reached the same levels as the other states. Okay, so I think one of the things to note here is also then what we've seen in the other states and territories. As PrEP use increases, a variety of other indicators change, and that can be tied to the requirements around taking PrEP, such as regular testing and screening, but it also changes in behaviour in the population. So I'll start going through some of those indicators now. So the first one is a legacy indicator looking at HIV testing in the population. Obviously, gay and bisexual men are the most HIV affected population in Australia, perhaps not in WA these days, but we do like to see, we expect to see relatively high levels of HIV testing. You can see here the top line, the proportion of the sample who say they've ever had an HIV test, at nearly 9 out of 10 in the most recent round, and there has been an improvement in the last number of years. And the green line is the proportion of non-positive men, so men who have not been diagnosed with HIV, who say they've been tested in the last year. And you can see there's also been some improvement there, although it's been stable in the last few years at nearly 3/4 of those men. We ask a range of questions about HIV testing in the survey. This shows you where men say they were last tested for HIV. I think this has been interesting, particularly in WA, because there's been a diversification of where men can go for testing, and the AIDS Council in particular setting up the M clinic means that you can see here that nearly a quarter of the sample say they've been tested at a community-based service, and that's probably M clinic. The most common place to get tested is still at a GP, excuse me while I wrangle my cat, and followed by sexual health clinics or hospitals. And I think this might be tied to PrEP use, that the proportion of men saying they're getting tested at clinics or hospitals has gone up a bit in the last few years, and that may be about PrEP access. We've also started looking at frequency of testing. Some of you will be aware that the guidelines in Australia have changed to encourage much more frequent HIV and STI testing for sexually active gay and bisexual men, recommending that people who have any kind of risks or more than a few partners should try and get tested three or four times a year. This is also the recommendation for PrEP users, particularly daily users who need to get their scripts refilled every 3 months. We see that a lot of them are going for quarterly testing. Now, this is showing you number of HIV tests in the previous year for all non-positive men in the sample. And you can see that men reporting 3 or more tests per year has gone up quite a lot, especially in the last couple of years. But the next slide, I'll show you, if we exclude PrEP users, and we do this in the report as well. If we exclude PrEP users, the proportion of men reporting that more frequent testing is flat. It hasn't really changed. And in fact, it looks like, most non-PrEP users in the sample, like 40% of them say they haven't had a test in the last year. We can argue this a few ways. I mean, the first wave of PrEP users were probably the most sexually active men in WA, and therefore, removing them from this group means that these men are probably less sexually active and lower risk. But some of these men would still be indicated for more frequent testing, and there hasn't really been much change in testing frequency among non-users. I'll just look at this question from Melissa here. Could participants have said they got tested at a sexual health clinic but were referring to M clinic? Or was the questioning quite clear? Thanks. So the question about where men got tested, where they last got tested for HIV, some of the responses are generic, like general practice, sexual health clinic, hospital. For community-based service in the Perth survey, we say e.g. M clinic. So we imagine that if they read it, that's the option they'll choose. I'm sometimes, however, suspicious that if you go to M clinic, it actually feels quite like a general practice, a very gay-friendly one. So I wonder whether sometimes some of the men going to M clinic tick general practice. That's possible as well. And I can see Garrett has joined us. Welcome. Okay, I'm going to move on. So what's the result? What are the results of testing? So you'll see here, as you'd expect, the majority of the men in the sample believe they're HIV negative or have had an HIV negative test result. Around 1 in 10 have never been tested for HIV. They obviously always remain a priority for engaging in testing. And there's a small group of men who are diagnosed with HIV in the sample. I've just noted here that the number of positive men in the sample is pretty small, and it fell in the most recent round. So I've had to cut out some indicators for the reporting here because they're not very reliable with such a small group of positive guys. Normally, the proportion of positive men in the Perth survey is about 4 or 5%. Okay, so just looking at those positive men with that caveat that they're a relatively small group. However, these trends are consistent with around the country. You can see in orange the proportion of positive men in the Perth survey who say they're on antiretroviral treatment, and you can see that that's gradually increased over time. This is consistent with what we see around the country. There's perhaps a slightly lower level of treatment uptake in Perth. In some of the eastern states, we see treatment levels well above 90% now. So that's interesting, although this is the caveat that this is a relatively small group of positive men. So, you know, I'm not sure what to make of that. The trend is upwards, which is sort of what you'd expect. And the blue line is of the men on treatment, the proportion who've achieved an undetectable viral load, viral suppression, and therefore their health and well-being is maintained, and they also can't pass the virus on to somebody else sexually. You can see there that, again, the trend, generally it's just a high level of viral suppression among the treated positive men in the sample, and actually all the men who were on treatment in the 2019 round said they were virally suppressed in 2019. Okay, so moving into some of the sexual practice indicators. This is, we make a distinction in the survey between sex with casual and regular partners. Regular partners is probably interpreted as boyfriends or husbands by most people in the survey, although some might include their fuck buddies, you know, regular sex partners in there. And then casual partners are partners who are less well known. So looking at sex with regular partners, the main change here that you can see in the last few years with the top line is in blue is the proportion of men with regular partners who say they don't use condoms with their partners for anal sex. That's gone up over time. This is consistent nationally. We should also note that obviously, like their heterosexual peers, most gay men in relationships or with regular partners don't always use condoms with them or don't use condoms at all. So this pattern is not particularly a surprise. As condomless sex at the top has gone up, consistent condom use between regular partners has gone down. That's in orange. And there's a relatively stable group, around 1 in 5, who don't have anal sex with their regular partners. We used to do this indicator for casual partners as well, but we've realised it's not particularly informative. So we have actually now, and I've made the break now, where I've replaced this graph for casual partners with this one, which is more colourful, but also has more detail about biomedical prevention strategies. So some of the indicators in this graph, although it looks quite different, are the same as on the previous slides. We've got no anal intercourse at the bottom, then consistent condom use. But then we reflect biomedical prevention use. So we've got in light blue, positive men on treatment with an undetectable viral load who report condomless sex. So from the light blue upwards, all of those men report condomless sex with casual partners, which you can see is now the majority of men who have casual sex. But in light blue are positive men on treatment with an undetectable viral load. In yellow, you can see the big growth in HIV negative men on PrEP. And above them are other negative and untested men in the two red groups who report condomless sex with casual partners but aren't on PrEP. So these men, the men in red at the top, are susceptible potentially to HIV infection if they're not using other strategies, but I'll show you some of those in a minute. And I suppose here the thing to reflect upon is, yes, there has been a big drop in condom use as PrEP use has increased, but the overall level of safe sex, which I would class as going up to the top of the yellow band, the overall level of safe sex has either been maintained or slightly increased in the last few years. And so we're sort of starting to refer to this as net prevention coverage. So all of those strategies we're classifying as safe from the dark blue up to the yellow. And 2/3 of the sample were reporting those safe strategies in 2019. In some of the other states and territories, as PrEP uses continue to grow, we've sort of eaten into that red group, those red groups have diminished in size. So we think we're actually getting even more, a higher level of protection and the potential to interrupt transmission as well. Hopefully that's clear. If you think of a question, type it in or let me know at the end. What else to say about that? I suppose the only other thing to note is, so if you look at the men in red in the most recent round, about 1/3 of men who have sex with casual partners are not on PrEP but are susceptible to HIV. So they remain your sort of target group for interrupting transmission between casual partners. Okay. Some of the other strategies I'm just going to show you are reliant probably on partners at least disclosing in some way, either electronically through mobile apps or online or talking to each other, very old-fashioned. And so this is a kind of a crude indicator of whether people are comfortable disclosing their HIV status to casual partners. We're having a bit of discussion with Garrett and the others about what other kind of forms of discussion or disclosure we could ask about, given there's kind of a few different things that people could talk about these days. But anyway, this is just showing you disclosure of HIV status to casual partners from the participants. It's split by HIV status. And you can see why looking back, because positive men were much more likely to disclose their HIV status than negative men back at the beginning of this reporting period. But actually the likelihood of disclosure has sort of converged over time, with about 3/4 of the overall sample saying they disclose status to at least some of their casual partners. So that, of course, then creates the conditions through which people can negotiate what kind of sex they have or to minimise risk. I think we've had some discussions in Perth about whether HIV disclosure is easier or more difficult than in some of the bigger cities as well. So there's often, we note that it is generally more tricky for positive men to disclose because they don't necessarily get good reactions from negative partners. Okay, so just thinking about some other risk reduction strategies. So on the rainbow coloured slide, we were just looking at what participants said they did. So condoms, PrEP, undetectable viral load, or not using any of those things, or avoiding anal sex. We do in the surveys ask about a range of other things as well that men might do if they don't use condoms with their casual partners, which is what the CAIC acronym refers to, condomless anal intercourse with casual partners. Now I can't do this, this is a shame, because in the other states I split this by positive and negative men because it shows you really different patterns of risk reduction strategies. But the group of positive men is so small this year, I just was a bit cautious about it. But I'll talk about them separately after telling you what's going on here. So these are negative men who don't always use condoms with casual partners, and this is what they say they do to minimise risk. You can see at the top, the most common strategy is serosorting. So this generally means restricting condomless sex to other negative men or men believed to be HIV negative. That has actually gone up over time and nothing much has changed in the most recent period. So that could be associated with PrEP use as well. Like if men are also seeking out men on PrEP, by default, other PrEP users will be HIV negative as well. So maybe they're ticking that box too. Some of the other states and territories, we've seen sort of a flattening in serosorting, even though it hasn't really gone down. You can see two steep increases in the most associated with PrEP here. So that's men being on PrEP themselves in yellow. You can see over half of men who've had having condomless sex with casual partners say they're relying on PrEP now. And in green, that their partners are on PrEP as well. So, and you'd expect those two lines to follow each other. But yes, the PrEP is now playing quite a big role for negative men who don't use condoms in Perth. And then we see some less frequent strategies and older strategies here. Strategic positioning, that's negative men taking the insertive role during condom sex, which poses slightly less risk of transmission. You can see that over a fifth of men used that strategy before, but it's declined quite a bit in the most recent period. And in orange, the other biomedical prevention strategy is having condomless sex with positive men who have an undetectable viral load, which obviously now is more prominent, particularly since the U=U sort of global campaign to reassure people that it is safe to have sex with someone who has an undetectable viral load and there is no risk of transmission. So you can see there are a minority of negative men report using that strategy. But just remember that, you know, in this survey, we're finding that fewer than 5% of the sample say they're HIV positive, and that's been fairly standard in the Perth survey for a long time. So that probably reflects community prevalence. But over 1 in 6 negative men who's having condomless sex with casual partners is reporting using viral load with the strategy. So there's actually quite a big group of negative men, relatively speaking, who's using undetectable viral load, but it's by no means the most common strategy for these men. Now, I should note that if you look at positive men, I wish we had more in the sample, the pattern of strategies used is very, very different. So serial sorting used to be the most common strategy, but the number of positive men frequently relying on that has really, really dropped in the last few years. And the proportion of men relying on their undetectable viral load has massively increased, as you would expect. And there's also a big increase in positive men reporting sex with men on PrEP. So quite a different sort of pattern to here. I'm just going to pick up on this comment in the chat. I think anecdotally, I found that clients at M-Clinic have concerns with disclosures. Many people mix in different circles for whatever reasons if they wanted to keep their status discreet. Yes, absolutely. And I think we've heard that before in Perth, that understandably positive men might be quite careful about who they disclose to and in which settings. Okay. Oh, I need to remember to click on the screen. I'll just show you sort of a short collection of other, I hope, short collection of other indicators. So STI testing, we ask about STI testing and particularly testing at different anatomical sites as recommended in the guidelines. One of the challenges with STI, comprehensive STI testing for gay and bisexual men is that obviously to do this properly, you actually have to test for pharyngeal, rectal infections, as well as testing urine or doing blood tests. And often one of the challenges is, particularly for ordinary GPs, is getting them to ask for anal and throat swabs in particular, and not just urine samples and blood tests. So you can see here that that pattern is replicated here, where syphilis test, which is serology, a blood test, in red, and urine sample in blue are much more commonly reported still, although there's been big improvement in men reporting anal and throat swabs as well, particularly in the most recent period. I think personally this is probably tied to PrEP uptake as well, that PrEP users in particular have much more regular STI screening. But overall, there's been a big improvement there, particularly over this longer time period, which is heartening, but it's still lower than the levels of men reporting HIV testing. We also asked about diagnoses. We're asking about specific STI diagnoses now, and I've put that there on the graph in black dotted line. You can see that now we've also had an increase in STI diagnoses, which you'd expect, given increasing levels of testing and increased levels of condomless sex. And you can see here nearly 1 in 5 of the whole sample reported any STI diagnosis last year, the most common being chlamydia and gonorrhea. I don't want to prefigure what this might look like if PrEP use goes up more in Perth, but in the other states and territories, we're seeing even higher levels of STI diagnoses now as PrEP use becomes one of the primary strategies, and undetectable viral load for more men in the samples. Okay, just showing you some, we ask about mainly illicit drug use in the last 6 months. We ask about a few other things as well, which I'm not covering here, like more frequent drinking and so on. But this is just showing you a selection of drugs which can be associated with just some of the most common ones, and also some of the ones that can be associated with sex partying or high-risk sexual activity. There isn't an enormous amount to report here. The main, the one I haven't shown you, the one that's the only real, so sorry, I'll just back up there. Gay and bisexual men tend to report higher levels of drug use than their heterosexual peers. That is reflected here. Some of these levels are very, very high compared with general population levels. Most commonly used drug is amyl or poppers, which is interesting given it's supposed to be more difficult to get hold of now, reported by over a third of the sample. And cannabis use, although that has declined over time. You can see some sex-related drugs, Viagra, and we assume that men, who are using other types of erectile dysfunction medication tick that box as well. And crystal use in light blue towards the bottom. Crystal use has declined. We've kind of seen that all around the country, actually. I think people are a bit more cautious about it. We don't see an uptick in other party-related drugs like G or ketamine in the Perth survey at the moment, I don't think. And ecstasy use, you can see, was much more common 10 years ago, but it's still reported by over 1 in 6 at the moment. Yeah, the only other drug that's gone up, and it's gone up in all the surveys, so go figure what's going on there, is cocaine use. So recent cocaine use has increased in the Perth sample, and we see that in most of the other big cities as well. Okay, where do men say they meet their partners? We include this because we think it's it's interesting for us to know where men are congregating or thinking about sex. Helps us with recruitment, but it also, I think, helps our partners with targeting programs. Obviously, the big change in the last 10 years is the massive growth in the use of mobile apps like Grindr and Scruff. And you can see that reflected here. Mobile apps are by far the most common way that men in Perth and WA say they met their most recent sex partners. As apps have increased in use, the use of the internet, so like web-based platforms, has declined. Sorry about that, I'm jumping ahead of myself. Meeting in bars is fairly stable, as is going to sex venues, although it's reported by a minority. And the Perth sample is fairly typical in that a reasonable number of men say that they have sex while they're travelling overseas or within Australia, although very few of us will be doing any of that anytime soon. And then a few of them, 1 in 10 in the Perth sample, say that they've met partners at beats, public cruising grounds. Okay, so in summary, and then if there are any more questions, we can deal with them. We see a jump in PrEP use in the most recent survey to a quarter of the sample. Just a reminder that the last survey was done, the survey was conducted in November, well before COVID-19. We have a relatively small number of positive men in the survey, but the majority are on treatment and have viral suppression. I believe the rise in PrEP use, consistent with other states and territories, is associated with increases in frequent testing, STI diagnoses and condomless sex in the Perth sample. And it appears that PrEP and undetectable viral load to a lesser extent play an increasing role in preventing transmission during casual condomless sex. And this is also consistent with the other states and territories. In terms of targeting, it appears that about 1 in 3 men who have casual sex remain at risk of HIV acquisition. And if the WA sample follows the others in the other states and territories, I think aiming to increase prevention coverage for casual sex is kind of achievable, and is probably something we will see in the next round. And I'd just like to acknowledge everybody who has made the Perth survey possible and has had input into it. Thank you very much. Now, I don't know how we want to do questions. Does anybody want to chime in? Would it be better if we could do audio, I think. I suggest, or you can put your hand up, or you can type, and then I'll respond. Oh, okay, so we've got, Rowena has typed something. Let me just have a look. So Rowena has mentioned the increase in online respondents and whether the profile's different. Yes, you're right. We typically do find that the online sample is a bit different. I mean, obviously it's more geographically spread out than the offline one. We also tend to get more younger and older men, so the youngest men and the oldest men. And we tend to get more men, more men in relationships, but they're also more likely to report condomless sex in those relationships. So that was fairly consistent once we started doing online recruitment. And so we made a decision just to treat the online sample as part of the overall sample and incorporate them. It could have affected some of the trends we see here, except I think just looking at some of the trends, that everything is kind of changing fairly consistently and in line with what we see in the other states and territories. So I'm not particularly concerned about the change in the sample profile. It might have depressed the proportion using PrEP. It's possible with the online sample, because we tend to get more men in relationships with it. Might be something we should have a look at. I think we're gonna be doing a bit of scrambling depending on how long COVID goes on. We might actually be more reliant on online recruitment next time we do this. Hopefully not in 2 years' time. Does anybody else have any questions or comments? I can hear someone thinking about a question. Oh, okay, so I've got a comment from Lisa. I will just also move slides so we can talk about this. Here we go. Okay, so Lisa has said the band of red men are very consistent over time. Are there any identifying features that would increase testing at least? Yeah, so Lisa, we haven't looked at this specifically in Perth. Tim and I have been doing an analysis for this nationally, which I imagine would apply, and there might be some regional variation. So a reminder here that the men in red in this slide are negative non-tester men who aren't using PrEP, but do have condomless sex, so potentially that risk. One of the things we're struggling with that Tim and I are looking at is if you look at men back in this early period, all the men who subsequently went on PrEP are up here as well. So the sample 10 years ago in the red group is high risk, high number of partners, more drug-related sex practices and so on. And a lot of those men have moved to PrEP use. So the men in red now appear to be less risky. So they have fewer partners. They're less likely to report frequent condomless sex. And so therefore, I think engaging with them is probably a little bit harder now because they may not see themselves as at ongoing risk of HIV. This is sort of a classic issue with engaging people who might occasionally be at risk. And we talk about this a lot in the broader team with, and in other projects about what this means for engagement, because many of those men in red probably genuinely are not high risk of HIV, but some of them are. So Tim has done, he may wish to comment or may not. He's recently just had a paper accepted where we've been thinking about men who don't consistently do risk reduction, who will appear in that red group. And he and I have been looking at this kind of classification to try and work out, well, what can we say about the men in red, either about should we be still as worried about them or how could we target them? And I think, yeah, the answer is it's not straightforward. I mean, we keep saying, for example, that maybe on-demand PrEP would be suitable for this group, you know, for men who are occasionally highly sexually active or at risk, but then that still requires them to sort of know that they're going to have that sex, and sometimes it's unplanned, and therefore that's a bit tricky for them. You know, similarly, they might not see daily PrEP as appropriate for them because they're like, I don't have sex that often, or I don't have condomless sex that often. Yeah, it's a tricky one. We could do a bit more digging. It's not a massive group for the Perth survey, but certainly when we finalise the national analysis, we could just check to see that the profile applies in Perth. Any other questions or comments? I don't know if Tim, did you want to comment on that at all? Not wishing to put you on the spot. You can say no.
Well, I think the main thing that's coming out of both of those analyses that you're talking about is, essentially in the most recent rounds, it is that less high risk behaviour, which, like you mentioned, it raises that question of how do you address that in people who most likely are considering themselves not to be at particularly high risk of HIV, due to less frequent, fewer partners, less frequent sex, all of those kinds of issues. That does seem to be the key message. There are a couple of other variables that came into play in the most recent paper around some demographic things, but the overarching message was that the level of risk is decreasing within that group.
Well, thanks, Tim. Lisa, I hope that answers your question. We can pick it up.
Yeah, I'm going to stop the typing and get back to old-fashioned talking. Look, I think that's really encouraging. I think that's a positive sign.
Yeah. Yes, I think it's one of those things where I think if these data go in Perth, WA, go the same way as Melbourne, Sydney, Queensland, that yellow segment will get much bigger and the red segment will decrease in size. And then I think we're kind of like talking locally going, we've actually got such high levels of coverage of safety, like through the 3 most effective strategies and men who avoid anal sex, that actually, the level of risk during casual sex has been, it appears to have been diminished. And that fits in with the epi in some of the eastern states. I guess actually I'm maybe that's a question for you about how you think things are tracking, with notifications among MSM, men who have sex with men in WA, whether it's kind of stable or whether you've seen a decline or.
Over the period of at the end of the trial, and indeed the notifications in gay MSM halved.
Oh wow!
So I haven't seen a report because we aren't getting notifications reports so much for obvious reasons. People are, off task doing other stuff. But yeah, it was down, I think, in the last report that I saw. So maybe the last quarter of 2019 down to from about 60 to 30 notifications, and definitely heterosexually and overseas acquired amongst heterosexual men is increasing and has surpassed gay men notifications. So,
right. Yeah. That's big, isn't it? So I mean, look, it kind of speaks to a few different things. So the interesting thing is then actually, where you have a smaller epidemic locally, then actually modest, this kind of quite dramatic, but introduction of PrEP can actually make quite a big difference. I guess the question that everybody's now looking at nationally is then in states that have seen that change, is then whether it can be sustained, and whether we can actually really get the numbers down. I think that's the thing that people are really interested about. But actually then, in a weird way, I think that also, I'm not saying that there's a lot of armchair epidemiology going on at the moment with COVID, but I also think that men respond to the local environment. It's not like they know exactly what's going on with the epidemic, but they probably know that there are fewer HIV cases, fewer people living with HIV in WA, and therefore, some of the behavioural practices we see, reflect the actual reality of having sex in Perth or WA. So maybe, you won't get such a high level of PrEP uptake locally because it's not needed or it's not perceived as necessary in some of the other cities. But anyway, that sounds really positive that you're seeing that that change, and that does suggest that this switch from other strategies to PrEP has been really useful locally. Yeah, it's quite exciting, isn't it?
It's great.
Cool. Does anybody else have any other questions? Conscious we're getting towards 7. I have now pulled a very long day, so I'm quite keen to start wrapping up soon. But if you've got a burning question, ask it now.